Doctors of Reddit. What's something someone came to the hospital for that they thought wasn't a big deal but turned out to be much worse? Story 1. I'm an ER nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head, just past her hairline and traveled under the skin, but on top of her skull to the back of her head. The other went straight in, but just fractured the skull behind her ear. Didn't go all the way through the skull. They were smaller caliber bullets. Apparently, she went to sleep the night before after taking an Ambien, and there was a drive-by shooting on her street. The bullets went through her window and she slept right through it. Story 2. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100 they were in remission and clear of cancer growth. I was spending a day with the scan techs and sat in. The scan didn't show one tumor. It showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went, and the tech said we couldn't. It was for the doctor. The old man winked at us and walked out. He was so happy. It was one of the days that told me I couldn't do that job. I've had quite a few people ask what I do now. How did I got into it? I edit a medical journal. I might do an AMA or something. Story 3. My dad went into the hospital in some pain. Back when he used to power lift. A nurse comes into the room, looks down at her chart, looks back up and says, "Mr. Pickle, you're having a heart attack." He got up on the bed and flexed, saying, "Does this look like a man that's having a heart attack to you?" She looked back down at her chart, up again, and says, "Yes." Edit. He lived through this, for those asking. He has since passed, but not from anything heart-related. Following the heart attack, he stopped with the powerlifting and got way more laid back. He started running more than lifting and learned to appreciate food a lot more. This was his favorite story to tell. I'm glad you guys could appreciate it. See. Story 4. Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse, but there were no swollen tonsils, so sent him for a chest x-ray. Huge baseball-sized tumors all throughout his lungs. One of them was pressing on the recurrent laryngeal nerve, causing his speaking and swallowing problems. He died within a week. Story 5. My best friend's sister went to the hospital for what she thought was a lingering flu. She walked out with a diagnosis of bowel, stomach, and liver cancer and died 9 months later. Story 6. A year or two ago here in Texas, a woman went to her optometrist for a regular exam. She later told the news after a long silence. He asks, "Did you drive here?" "No." "The person who drove you here needs to drive you to a hospital immediately." "Why?" "Because you're about to have a stroke." Story 7. Don't have much time, so I will keep this short. Patient presented with a small, less than 1-inch scratch on his right thigh and severe pain and immobility. On palpation, there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound, but as soon as the surgeon cut the skin, the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an x-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens, and that the infection was spreading fast. He called his family and loved ones, got a lawyer, and said his goodbyes. 12 hours after admission, he was declared dead. Story 8. Not a doctor, but I was in a fender-bender car accident. I was at fault, and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours, several x-rays, a CAT scan, and 4 doctors later, I found out my spine was broken and, get this, healed. The best theory any of them could come up with was that my spine had broken during birth, and since we never knew, it just healed itself, filling in with cartilage. One of the docs told me that, had we known my spine broke at birth, I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact I was probably in a lot of pain. Story 9. December 7th, 2012. We brought my father-in-law to the ER because he just wasn't acting right. Mixing words, feeling tired. My husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too because of his symptoms, and he was 79. They did a scan, and nope, cancer. 3 huge tumors in his brain. We took him for more tests the next day, and it was lung cancer. A tiny spot in his lung that traveled to his brain. He died 13 days later, on my husband's birthday. Story 10. Not a doctor, but a couple of years ago, my mother had a lump in her breast, so she went to get it checked out for breast cancer. Her mom died of breast cancer, and her sister has had it twice and has had her breast tissue removed. Fortunately, however, it was just a cyst. But wait, there's more. Turns out hiding behind that cyst was some early-stage cancer. Was easy to get rid of, and she's fine now, edit typos. Story 11, I thought I had a nasty flu strain. Was feeling generally like, didn't go to hospital until 2 days later. Was in operating room less than an hour after that. Appendicitis. Story 12, not a doctor. Sorry, I'm gonna be that guy. After I got my appendix out, I went back a week later thinking I was constipated. Nope, I had a giant abscess that had started to wall itself off. They went in the drain it, and I woke up in ICU 5 days later recovering from sepsis, septic shock, and kidney failure. Story 13, not a doctor. I'm an EMT, but when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently, this was something he had been getting waivers for years for. I had just finished an AP class and learned about something called Brugada's syndrome, which is basically an arrhythmia that causes sudden cardiac death in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no way he actually had it and it had to be artifact from the EKG. The doctor's eyes widened and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home, and had a defibrillator put into his heart before being medically retired. TLDR, I accidentally diagnosed a man with certain death. Edit, holy cow, this really blew up. Thanks for the gold, kind stranger. Story 14. I'm not a doctor, but this happened to me. I have suffered from chronic earaches and ear pain since I was a few months old. When I was in 8th grade 1, I was sitting in class when my ear popped, except this wasn't the normal pop that releases the pain. It felt like Simone had shoved a red-hot metal rod in my ear. Under closer inspection by my pediatrician who has dealt with my ears my whole life and is one of the few doctors that believed that I was in pain, and he said it was the worst eardrum rupture he had seen. But since I have had this happen a lot, I just took some medicine and went home. Over the next few months, my earaches got severely worse, so I went to see an ENT, who basically told my family, nobody's ears hurt this much, or are this sensitive, he is faking to get out of school. After my 5th visit in a month to that ENT, he suggests a MRI. At least I think that's the big circle thing with the magnets. Ends up that bad rupture had caused the skin in my ear to grab onto the bones in my ear and form a tumor called a cholesteatoma. This tumor was literally eating away at my ear, the bones in it, the cartilage, and was eating into my skull. I went to see a specialist for this who ended up removing the tumor after a few months and having to completely reconstruct my eardrum and the bones. And a lot of the damage could have been stopped if the original ENT had believed me about my chronic pain. The result in all this is that I have an artificial eardrum made from the muscle in my jaw. They kind of botched that part, I think, because I can't even chew food really with the left side of my jaw after it, and the bones were replaced by the cartilage from the outside portion of my ear. The surgery resulted in bad nerve damage that makes every day a struggle, and I can't hear out of my left ear. TLDR, I had my eardrum burst, which resulted in a tumor that wasn't noticed by a doctor because he thought I was faking. Had the tumor removed, but I lost my hearing and have to deal with pain from the nerve damage every day. Story 15. When I was 12, I had a crazy bad headache that wouldn't go away. My dad brought me to the doc and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a burst sinus cavity, as in all the bones around my eye broke and the liquid leaked back onto my brain, giving me brain meningitis. My eye was bulging out to the point where I looked like an alien, and they told my parents I was not going to make it. Obviously, I pulled through, but was hospitalized for 2 weeks and missed 2 months of school. I was at the time only the 3rd known case of this happening, and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. Story 16. Not a doctor, but one night, I suddenly had serious stomach pains. After failing to sleep it off, my parents wanted me to stay home from school, but I declined for I had quizzes that day. I sat through US history, Algebra 2, and even tried to eat lunch. Still in agony. So, after finishing my English quiz, I waddled down to the office and called my mom to get me. At this point, the pain is so bad I can barely stand. So my mom takes me to the doctors. Turns out, my appendix was ready to explode. Story 17. Paramedic here. We got called out one Christmas for a grandfather who was tired after eating a huge turkey dinner. We get there, and the first responders are standing around outside in high spirits. I walk in, slap a EKG on him. Massive MI heart attack. Went from happy turkey coma to heart attack in 3 seconds. Story 18. My mother was in town visiting for Christmas. Suddenly, she was slurring her speech, acting belligerent, and all around confused. Tested her blood sugar, and all it said was error. We get to the ER and she passed out. Her blood sugar was a 19. Her liver spontaneously failed. The best the doctors can guess is she caught a virus and it attacked her liver. 4 days after the onset, she got a liver transplant. A 22-year-old woman in Baton Rouge, Louisiana gave my mother the ultimate gift. Please, become an organ donor. Please. Story 19. Not a doctor, but I was a patient in a similar situation. I had a sudden pain in my abdomen that doubled me over. I was sure it was just probably really bad gas pain, and if I just took a really good I would feel better. But at the time, was insistent we went to the ER. Get to the ER and they do an ultrasound. Instead of the giant gas bubble I expected, they discovered a cyst on my ovary the size of a softball. The doc advises that they are very common, and the usual course of treatment is to give me birth control pills and send me on my way. But since this one is so large, he wanted to consult with a gyno. This being a podunk coastal town, the gyno on call was over a half-hour away, so instead of bring her in, they send her my results. The gyno agreed that most likely everything is fine, but the tech who did the ultrasound had left out a picture of the blood flow going into the ovary. The gyno wanted that pic to be absolutely certain things were fine, even though the tech stated they had looked at it, just forgot to snap the pic, and everything looked fine. Still had to go for the second ultrasound. The second ultrasound showed the blood flow was fine, but now my abdomen is filling with an unknown liquid that had not been there before. At this point, the gyno decided to drive in and examine me herself. I'm told I don't have to wait in the room and can go out to the waiting room if I would prefer, since it was going to be a while for her to show up. A few minutes later, I'm out in the waiting room and I want some water. My SO had to be home with the kids and the neighbor is with me and offers to get me the water. I drink said water and stand up to walk about 10 feet to throw away the paper cup. Halfway to the garbage can, I suddenly feel very nauseous, shaky, and weak. I barely make it back to my seat before I vomit pretty violently. The nurse tells me to just stay seated and not to drink anything else until the gyno arrives. I feel fine the rest of the time. I'm waiting for her. When she finally arrives, we talk and she explains she wants to do this procedure where they stick a very long needle through my cervix and draw a sample of the liquid. She's pretty sure it's a leak in the cyst and that the body will just absorb it and I'll be fine. But she wants to be 100. So there I am, my legs in the stirrups while the doc tries for her sample. And tries 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 and OMG, stop trying already. After piercing my cervix something like 20 times, she finally gives up. All she can get is the blood from the now many holes in my cervix, and she states she can't torture me anymore and is giving up. I'm so relieved that that is over, and am so ready to get out of this podunk hospital. And she seems ready to send me on my way as well. She tells me that she is 99, sure that the fluid is just a leak from the cyst, and that'll be fine. But that if I would prefer, she could perform a laparoscopy and find out for sure. But that it's up to me. I ask her what the worst case scenario is here. She says, well, the worst case scenario is that it's not cyst fluid but is blood, and that you're hemorrhaging, you don't get back to the hospital in time, and you die. At this point, I'm thinking there's no way I'm gonna die from this, so I can probably go home, but I ask you said not get back to the hospital in time. I came to the hospital because of the sudden pain. But you guys have me on pain meds now and I'm not feeling any pain, so how will I know to come back to the hospital? She says, well, you'll get really nauseous and weak and shaky. I respond, I did that in the waiting room waiting for you to get here. The gyno takes one look at the nurse who nods in agreement and her attitude immediately changed. She explained we are going to do the laparoscopy ASAP. She explains it's only going to be about 15 minutes total. They're just going to cut a little notch in my belly button, blow in some air, put in a camera, and take a look. I sign consent forms, and then I'm prepped for surgery. Up to this point, I've not felt scared or worried about the situation. The information is coming in, I'm analyzing it and responding, but emotional. I'm like a rock. But when I was laying on that operating table just as they were putting the oxygen mask on my face to put me out, I glance at the clock and realize it's striking midnight. That's when it hits me. I'm on an operating table in a tiny hospital in a tiny town and midnight is serious. Just as I can feel him starting to freak out, I'm under. The first thing I become aware of is this strange whooshing sound and the sensation of something alternating squeezing my feet. I open my eyes and everything is bright and white. I feel nothing at this point other than the squeezing. Out of the corner of my eye, I notice a large window and movement behind it. I turn my head towards the movement and the most excruciating pain I've ever experienced washed over me, radiating out from my stomach. I scream out in pain and clutch myself. A nurse comes rushing in and at that moment told me what had just happened. Apparently, as soon as the gyno put the camera into my abdomen, the cyst, and my ovary burst. I was gushing blood like a garden hose. That 15-minute exploratory surgery turned into a 2-5-hour emergency surgery to save my life. She gave me a shot of drugs and I went back to sleep. The next morning, the gyno walked into my hospital room, and the first thing she said to me was, If I had sent you home last night, I would have killed you. It was a very sobering moment, realizing just how close I had come to death and had no clue. The ovary was going to burst whether I had that surgery or not, but to be on the table surrounded by doctors when it happened is probably the only reason I'm still alive today. That and the fact the ultrasound tech forgot to take a picture. TLDR went to the ER but was convinced I had to take a but-discovered large cyst. Ultrasound tech's mistake leads to life-saving information. Doctor almost kills me by sending me home, but in the end, I kept my shoes on. Not a doctor, but I was taken to the ER for what I thought was a small infection, even though my arm went numb cold. For some reason, I was entirely emotionally distraught and couldn't think clearly. The doctors took care of it, and I ended up not being able to use my arm for a week. Turned out, it was a staph infection, and I was told that if I had waited 2 to 3 more days, it probably would have killed me. Story 20. Not a doctor either, but this happened to me. About 4 months after I had my son, I started to notice the vision in one of my eyes was really off. Blurry, spotty, etc. I didn't really think about it much because my eye didn't hurt and wasn't itchy, and I had a new baby to take care of. Anyway, it lasted for months, and finally my mom and sister convinced me I had to go to the eye doctor for it to see what was going on. I took baby with because I thought, hey, quick apt, maybe 20, 30 mins, and I'll probably leave with some eye drops or something. Honestly, one of the worst days of my life. They put me through test after test. I was there for hours. I ended up calling my mom to come get the baby. They weren't telling me anything. They scheduled an MRI for the next morning because by this time my 11 a.m. appointment had dragged out until 5:30 p.m. and the clinic was closed. We were the only people there. Still no answers. I am freaking out. Go back the next day and get the MRI done. They send me to the neurologist this time. No eye doctor S today. When I walk in, he has all the results from my test the day before and the MRI I had just taken a while before. I was told I had multiple sclerosis. It was very scary. They edit too for those that have asked him doing pretty well. Still in the first stage of relapsing remitting, Ms. I've stayed hardcore on my therapy, and my family is extremely supportive, which makes a huge difference. The first years were the hardest with a toddler and learning to adjust. Now he's 10 and more self-sufficient. We decided not to have more children, which was really hard, but overall the best decision for our family. Story 21. 16-year-old girl brought to the ER by her mom because of flu-like symptoms for the past week. Check her blood. AML acute myeloid leukemia. Despite treatment. Dead in 3 days. Story 22. Not my story, but a good one. A guy was involved in an MVA and ended up dislocating his hip. Got him strapped in and taken to the hospital where they ended up popping his leg back in. Now, dislocating your hip isn't very common. The upper end of the thigh fits in like if you were to make a fist with one hand and then cup your other hand around it from the top. There's also quite a few ligaments and tendons really holding it in there. So when they pop it back into place, there's a significant amount of force holding it in. Anyways, the guy was in pain but conscious during the transfer, and when they got him to the hospital, I forget what drugs they gave him, but he was still making sense and responding appropriately. This changed as soon as they put his leg back into his hip. Tao immediately screamed and passed out. He then proceeded to wake up, scream, and pass out again. This happened several times while the doc started to panic trying to figure out what had gone wrong, eventually sending the guy for x-rays. Turns out that his testicle had rolled into the cavity between his hip and his femur, so when they popped it back in, it crushed his nut. So, yeah, that turned out to be pretty serious, I feel. Story 23. My mother woke up one day and her arm was numb. After about 45 minutes, it was still pretty numb, and she thought she had pinched a nerve in it sleeping, but went to the ER just in case. She had a stroke, which actually was caused by a blood clot, which moved up from her heart, and exited a hole in her heart, a congenital defect she was unaware she had. She ended up fine and feeling in her arm came back, but she was incredibly lucky that it did. Story 24. Not a doctor, but my ER doctor told me if I had waited 12 more hours, I probably would have died. So I was taking antibiotics for dental work that had been done, and noticed these weird blisters showing up everywhere. Weird, but whatever. 48 hours later, they started opening up, leaving holes in my skin, no blood, just lost most of the skin in that area. Again, weird, but I was working, so whatever. Then they started appearing in my throat, so I got to the hospital ASAP and was diagnosed immediately with Stevens-Johnson syndrome. Any longer and the layers of my skin would have literally peeled away from each other and I would have died. That was a sobering day. Story 25. We got an older patient in the ER because he fell from a stool while replacing a light bulb. The family just wanted him to be checked because he fell on his head. He had nothing. While waiting for the papers, the family started to scream, "Doctor, doctor." When we rushed in, it seemed as if he was having a cardiac arrest, We put him back on the bed, hooked up an ECG, he had an AV block. So the reason he probably fell from the stool was because of the AV block. At first, he was such a happy guy and joking around. After we told him what he had, he could only say it's in my heart. This means the end is coming. TLDR came in because he fell from a stool, fell because of a heart condition. Story 26. Not a doctor, but a nurse. I was working in postpartum care and I cared for a patient who had come into the hospital in labor with her first child. She ended up requiring a C-section. In the OR, they opened her up and found her belly full of cancerous growths. They immediately paged an oncologist at a neighboring hospital. We were just a women's and children's hospital to come immediately while she was still open. It wound up being terminal. She wouldn't even have known if she hadn't needed that C-section. Can you imagine going to the hospital to have your first baby and leaving with a diagnosis of terminal cancer? I think about her all the time. Story 27. Obligatory. I am not a doctor, but my friend went to the doctor because she had swollen lymph nodes in her neck. The doctor told her she had some infection and gave her a prescription. A week later, nothing had changed. She went to the hospital and was diagnosed with Hodgkin's lymphoma. She was supposed to have only 6 months of chemo, but it took her 2 years of chemo and a bone marrow transplant to be cancer-free. Story 28. Not a doctor, but this did happen to me. I had gallstones for 3 years or so before I finally got my gallbladder ripped out last year. At its worst, I was getting an attack maybe once a month or so I figured it couldn't be that bad. I went to the surgeon for my post-op checkup. He told me that my gallbladder was filled with hundreds of stones or varying sizes and that it was precancerous. Apparently, people don't typically get gallbladder cancer until they are in their 80s or 90s, and it is often very serious because people don't catch it right away. I'm in my 20s, and like I said, I had been sitting on this problem for 3 years I finally toughened up enough to get it checked out. Scary, man. Story 29. As a physician, listen to your bodies. You guys know yourselves much better than we will even after talking to you in an ER for 5-10 minutes. If something is going on that is far outside the usual, please come into the ER. I would much rather see you and tell you you're fine and worried well than sick beyond the point of repair and a fool for having ignored your symptoms. Story 30. I worked in an ER fast track when a mother brought her 8-year-old daughter for abnormal discharge. Aside from the age, this is nothing unusual as we see many complaints like this throughout the day. The mother thought nothing of it, maybe she's on her period. The doctor, however, was suspicious from the start, so he ordered a gonorrhea chlamydia test, which turned out positive for gonorrhea. Unfortunately, we had to discharge the patient on the initial day due to some tests such as cultures taking much longer to result. But the very next day, we checked the results and immediately started calling CPS. The mother was not happy to say the least. Story 31. This obese 400 lbs. Women came in complaining about her stomach hurting. Turns out there was a dead baby in her vagina. It was there for a few months and she had no idea. It was everywhere, not just in the vagina. MB. Story 32. One girl was feeling really strange and went to the doctor. She was feeling really weak and had trouble breathing. Turns out she had refeeding syndrome and had cardiac arrest while in the hospital. She was transferred to my treatment center for anorexia. That is where I met her. She tried to start eating on her own after years of restricting. Didn't work out too well. I was a patient there. When I first came to this thread, there was not a lot of response, so I added my experience so OP could get a response. Story 33. I saw ish woman at the ER last year. She asked us if she might have something wrong with her breast. During my exam, I couldn't help but notice that her left breast was bumpy, talking like 5 centimeter mass protruding. The nipple was inverted and leaking blood. Clearly a textbook case of cancer. The woman had a pretty high-paying job and seemed pretty smart, and was clearly in denial. Paramedic here, but at the time I was still a student. PT was brought in for back pain. They decided to do a bedside ultrasound because they felt a pulsating mass in her abdomen. She was about one funny movement away from her aorta exploding. Story 34. My friend's mother was on vacation in Key West, and as they were walking down the beach, her husband pointed out that the toes on her left foot were all sandy, and the other one wasn't. She had been kind of dragging the front of her foot, but only on the one leg. The mom vaguely mentioned that she'd been kind of having a little trouble lifting the front of her foot up, but figured she just strained something from running barefoot on the beach a few days earlier. She went to a doctor to see if she could get some anti-inflammatories. After questions and recommendations to see a specialist, they figured out that she has ALS Lou Gehrig's disease. This was 6 years ago. Now she is totally unable to move, talk, and breath on her own. All she thought she had was a sprained foot. Story 35. My girlfriend is in here, final rotations for radiology. A while back, a young girl came in after winning a basketball championship. She had some shooting shin pain but wasn't in a lot of pain, still glowing from the win and talking excitedly about a scholarship offer. When her scan came back, about 60 of the marrow in her tibia was one big sarcoma cancer. Surgery and therapy essentially ended her shot at a full ride. Story 36. Someone needs to post a link to Ray Bleach, or a reminder that today really isn't that bad of a day, and that you're in good health for someone your age, weight, and/or gender, and not riddled with cancers filled to the brim with anything but love and sunshine. And get that to the top comment slot, because a lot more people need to see it before this cavalcade of misery. Story 37. I work for the fire department, and once a month we have to do body recovery, pick up dead bodies. Well, one day we were sent to the local hospital to pick one up, a 48-year-old female. She came in with a stomachache at 7 a.m., and while they were running tests, she died at 11 a.m. When I picked her up, they hadn't gotten tests back, and I never looked back on the autopsy, but it's just crazy how, the first time she complained of this stomachache, she was dead. Story 38. This actually just happened to me a few days ago. I'm an internal medicine resident who's doing rotations in the ICU. If there is an emergency on the floor on admitted patients, the ICU team gets called to see them. So we got called to an emergency where some admitted 59-year-old patient got dizzy and almost passed out while on the commode, a portable toilet for patients. He was originally admitted the day before for high fevers and a high white blood cell count, which they attributed to some unknown infection. No real medical history except high blood pressure and cholesterol. We assessed him, and he seemed a little tired, but he was awake. His vitals were okay, although heart rate was a tad high, like 105. Normal is 60-100. On examination, his belly was somewhat tender. We ordered a lactic acid, which is elevated if some organ isn't getting enough oxygen, and a CT scan of his abdomen. The labs were ordered stat, but since his vitals were fine and his exam was not too alarming, we didn't push for things to be done immediately. Since I had a small break while waiting for results, I watched the Seahawks with their crazy comeback against the Packers. While I had just opened up the CT scan to read it, I got a call from the radiology resident. The results showed that the patient had a ruptured abdominal aorta and right iliac artery. In other words, the major vessels in the abdomen had completely burst, blood was pouring out at incredible rates, and the patient needed surgical reparation immediately. The death rates for this are about 90. At this point, we ran to the patient, who was still awake but irritable, and his blood pressure was around 60. Systolic normal is 120, which meant this guy was probably bleeding out like crazy. His sister saw the urgency in our faces and just broke down in tears, knowing something was wrong. The nurse let her out while we managed this patient. We gave him fluids to bring his pressure back up and called a vascular surgeon. The surgeon said this guy is already dead but was on his way. Unluckily for this guy, this was a Sunday, and none of the OR team is in the hospital, so we had to keep him alive while we waited for the surgeon and his team. The blood pressure came up to like 110 systolic, but it did not mean much. His belly suddenly got crazy distended, probably from all the blood pooling in there, and his heart rate fell down to the 40s with ST elevation seen on the monitor, probably started to have a heart attack due to decreased oxygen. His pressures tanked, and we lost a pulse. It was time to start chest compressions and intubate. The guy put a tube in his trachea and put him on a ventilator. We got a pulse back, and his pressure surprisingly came back to an acceptable range. What happened was that the blood had filled his abdomen to its max capacity, so all that abdominal pressure was causing his belly to get distended and hold the blood in its vessel, aka tamponade. The guy was hemodynamically stable for another hour or so while we waited for the team. When he finally made it to the operating room, the team was ready for quick action. The team has a few seconds to clamp off this guy's vessel while they try to repair it. However, as soon as they cut the patient's abdomen open, blood just poured out at a rapid rate. The pressure dropped so fast that the patient died within seconds on the table. TLDR, 59-year-old guy came in for what he thought was a flu, ended up having a ruptured aorta, died on the OR table in seconds after incision. Story 39. All these appendix stories reminded me of one from school. I guess it's slightly off topic because no doctors are involved. My friend and I got detention for PE. I can't remember why, but after school when we went, we had to run laps around the gym for a certain amount of time. But my friend was complaining of a stomachache. The teachers thought he was lying to get out of detention, so made him keep running anyway. He ended up collapsing and being taken to hospital, had appendicitis. Apparently, he could have died if he was made to run much further. Story 40. Many 50, 60 years old. Patients with a history of smoking going to the hospital for a persistent cough or a bad headache caused by an advanced lung cancer with brain metastasis. Story 41. One time, I was in severe abdominal and lower chest pain. I tried to tough it out, but it got bad. Went to the dacto, and I was laying on the table when the doctor pushed on my stomach to see how much it hurt. I suddenly belched incredibly loud and for a very long period of time. I thought I was going to pass out from belching. After that, I was fine. They decided to give me an EKG and then they found nothing. I was fine. This threaded needs a non-freak out causing story.